Welcome to another edition of Healthcare Signals That Matter, powered by Intent.Health, with me, Meghana Arun Pillai. This week, healthcare news wasn't really about individual stories. It was about 8 major signals that are reshaping the future of healthcare. The first signal, Ebola has evolved from public health story into a global health security issue. The second, AI is rapidly becoming healthcare infrastructure. The third, GLP-1 drug continues to reshape healthcare economics. The fourth, drug pricing pressure is intensifying across the industry. The fifth, precision diagnostics are changing how diseases are detected and treated. The sixth, capital continues pouring into healthcare innovation. The seventh, regulatory oversight is becoming more aggressive. And the eighth, trust is emerging as one of the most valuable assets in healthcare. Let's break down the signals that matter this week. Signal 1. Healthcare is now a national security issue. One signal dominated the healthcare landscape this week: Ebola. The United States expanded airport screening efforts. Travel restrictions were extended. Americans returning from affected regions were directed through designated entry points. The US, Canada, and Mexico coordinated travel measures ahead of the World Cup. The WHO warned that the outbreak is beginning to outpace response efforts. And WHO leadership traveled directly to Congo to oversee response activities. Perhaps most importantly, the US even moved to establish quarantine infrastructure for exposed Americans abroad. The signal is clear. Healthcare preparedness is no longer simply a public health responsibility. It is increasingly becoming a national security priority. For healthcare organizations, travel operators, health systems, and policymakers, the lesson is simple. Preparedness is no longer optional. Signal 2. AI is becoming healthcare infrastructure. Just a few years ago, healthcare organizations were experimenting with AI. This week showed how much that has changed. Healthcare AI company Commure reached a valuation of $7 billion. The US Department of Health and Human Services launched an AI initiative to detect fraud and waste. Bristol Myers announced the use of anthropic Claude AI to accelerate drug discovery, and Zuckerberg's philanthropic venture unveiled a new AI world model designed to accelerate scientific research and pharmaceutical innovation. The signal here is powerful. AI is no longer a future healthcare technology. It is becoming core healthcare infrastructure. Healthcare organizations that view AI as an experiment may soon find themselves competing against organizations that view AI as a capability. Signal 3. The GLP-1 economy continues to expand. Few healthcare categories are moving faster than obesity treatment. This week, Eli Lilly reported that patients taking its next generation obesity therapy lost as much as 28% of their body weight. At the same time, CVS restored coverage for Lilly's obesity drug Zepbound. New data showed Lilly's Mounjaro outperforming competing GLP-1 therapies for some diabetes patients. And regulators in Alabama warned healthcare providers against the use of non-FDA approved peptides. Taken together, these stories point to a larger signal. The obesity market is no longer just a pharmaceutical category. It is influencing payers, employers, wellness companies, healthcare providers, retail health, and consumer behavior. The GLP-1 economy continues to grow far beyond medicine itself. Signal 4. Drug pricing pressure is here to stay. This week delivered several major developments around drug affordability. The US Supreme Court rejected a challenge to federal drug price negotiations. Trump announced plans to expand discount drug pricing initiatives. Trump RX announced plans to offer 600 generic drugs. And Takeda faced a jury verdict related to delaying generic drug competition. These stories all point towards the same conclusion. Healthcare affordability is becoming one of the most powerful forces shaping healthcare strategy. Pharmaceutical companies, payers, PBMs, and providers will increasingly be forced to balance innovation with affordability. Signal 5. Healthcare is shifting from treatment to prediction. Some of the most important stories this week were not about new drugs. They were about identifying disease earlier. Veracyte introduced genomic testing capable of identifying breast cancer patients who may avoid chemotherapy. A blood test was added as a new option for colorectal cancer screening. Research highlighted the benefits of early childhood screening for type 1 diabetes. These developments point toward one of the biggest long-term shifts in healthcare. The future of healthcare is not simply better treatment, it is earlier detection. Predictive medicine, precision diagnostics, and preventive healthcare continue gaining momentum. Signal 6 of the week. Capital continues to flow into healthcare. Despite regulatory uncertainty and economic pressures, investors continue making enormous bets on healthcare innovation. Eli Lilly announced plans to acquire 3 vaccine developers for nearly $4 billion. Blackstone committed up to $1.3 billion to Apogee Therapeutics. Pfizer and Innovent signed a cancer drug deal worth more than $1 billion. Boston Scientific invested $1.5 billion into Mirus. Cardiovascular drug developer Cardigan filed for a US IPO, and Medtronic announced a $650 million acquisition of SPR Therapeutics. The signal is obvious. Capital remains extremely bullish on healthcare innovation, particularly in oncology, immunology, vaccines, cardiovascular disease, and next-generation therapeutics. Signal 7 of the week. Regulatory risk is becoming a business risk. This week also demonstrated how regulatory developments increasingly shape healthcare business outcomes. California sued 23andMe over its data breach. The US Health Department made changes to a major vaccine advisory structure. The No Surprises Act dispute process received regulatory updates. Healthcare litigation involving gender-affirming care continued evolving. The FDA faced scrutiny around tobacco regulation, and regulators flagged manufacturing concerns at a pharmaceutical facility operated by Dabur. The signal here is critical. Healthcare organizations must now treat regulatory intelligence as a core business function. Regulatory risk increasingly carries financial consequences. Signal 8 of the week. Trust is becoming a competitive advantage. The final signal this week may be the most important. Trust. California's lawsuit against 23andMe brought healthcare data privacy back into focus. Dexcom warned patients about stolen glucose sensors entering the market. Insulin disclosed a dosing defect impacting some devices. Nestle and Danone faced scrutiny over baby formula recalls, and Meta settled a case involving youth mental health impacts. The common thread is simple. Patients, providers, regulators, and consumers increasingly expect transparency. Trust is no longer a soft metric. Trust is becoming healthcare infrastructure. So, what were the healthcare signals that mattered this week? Healthcare preparedness is becoming a national security priority. AI is becoming healthcare infrastructure. GLP-1 therapies continues reshaping entire markets. Drug affordability pressures are accelerating. Diagnostics are moving healthcare toward prevention. Investors remain bullish on innovation. Regulatory oversight is intensifying, and trust is becoming one of healthcare's most valuable assets. The biggest takeaway? Healthcare is no longer changing one sector at a time. Technology, policy, public health, regulation, capital markets, and consumer behavior are now moving together. And the organizations that recognize those signals first will have the greatest advantage. This is Meghana Arun Pillai, and you've been watching Healthcare Signals That Matter, powered by Intent.Health. See you next week.